Now, a word about, that I'm coming to a very, controversial issue of doctors getting assaulted, which is actually a very big blot on the society. A society where doctors and all the noble people get assaulted for whatever reason. Assault is not justified. We are not trying to say, since we all share the same background, that doctors don't do anything wrong, but to be able to get the best out of doctors, the least you can do is respect them for what they do. And it takes a lot of hard work to become one. And they're working even harder to sustain what they are doing. And one doesn't understand that a doctor cannot smile if he has to see 100 patients in a day. It's different in the UK and US. You can't see more than 15 patients in a day. It's punishable because it is not expected that you'll do your best. And here the OPD could be full of patients, 200 plus, 150 plus. So naturally, his behavior could be, he's not working in the same kind of an environment. Having said that, we are not justifying that there should be no communication. There is a problem with communication amongst doctors for which they never get trained. Thankfully, now MCI has introduced it as a part of curriculum, and there are communication skill courses that at least we run at our place, and I run it as a program for the rest of the country in our MedSicon conference. But this is an issue and problem. I'll take the opinion of the members of the panelists as to how they look at it, because generally we know the problem, and we don't try to say that one is right or wrong. But any civilized country, a society which is civil, would not assault anybody, leave alone a doctor, because there can come a moment when we were talking to a kid in the morning and they wouldn't like to be doctors, so you wouldn't have any doctors. So what do you do then? Who do you beat? You can't beat up the ghosts. So we have these, and they come out of the same society, so don't expect them to be angels when the society is undergoing changes. Dr. Gupta, your views on that?
I think this is a very important aspect, and I believe that we say society gets what society deserves. And eventually, if the society is going to beat up the hardworking doctors, no doctor does anything wrong intentionally. It may be out of circumstances, out of situation. And you also rightly pointed out, we also say that there has to be a foundation course for communication skill and ethics being taught to medical students from the time they join the medical college. And doctors during internship and during residency program, they should be taught to communicate with the patient about the good news and bad news also.
Yes.
There we are lacking in our training somewhere. At the same time, society also should follow certain restraint in expression of their anger out of something. I mean, incidents can happen, but just to react differently. And as I read somewhere in the management book, that you can't prevent the incidents to happen, but you can alter your response to that incident.
Correct.
And I think that's very important thing, both for the society and both for the doctors. The response to particular
Absolutely,
incident.
both need to be working at it, Dr. Uni.
Yes, I think it's a complex issue. I think, as mentioned, a change in society. And I remember during my MBBS days and during my MD in the Christian Medical College, Vellore, of course, the patients were much more trusting and friendly, and doctors
In
were...
civil, they still are trusting.
Yes.
Unfortunately.
The patients are... But at the same time, the society has changed from what it was before.
Yes.
Because people would like to know the internet is there, and a lot of stress in general life as well. So when there is a health issue that causes some sort of friction, the patients are agitated. So as both of you said, I think the solution is to train our medical students in communication and in soft skills. I think this is a vital part of training.
I agree with you. And actually, I'll just share with you one classical example. I was examining at an institute in one of the regional parts, some regional institute. The candidates were struggling to communicate, even while presenting their examination. They're presenting their history and examination. They would start off in English. I'm not trying to say English should be followed, but that's the way we are. We have a curriculum that is British. So you can't teach in local vernacular. Now, they were not able to communicate. They were not able to communicate the history as well as they should. And I was looking, every year I used to go, so I was looking at what to do. So they asked me, can you take a lecture on skills of this thing, communication. And this incidentally happened one day after the exam. So I spoke to the local faculty. Most of the communication between faculty and the students is in their local language. This is where we spoil
Yes.
it. So again, the faculty is responsible. In our rounds, I made it mandatory that we speak only in English. Bad, good, whatever, everybody improves. But they'll have to learn that skill. What that does is they don't speak loose words in front of the patients, which the
Exactly.
patients understand. Like in Hindi, they would say, "Iska," something which the patient can make up.
Yes.
So communication skills are a responsibility of the teacher. And a lot of us, while communicating with our patients, don't realize, maybe we realize, I'm not trying to say, that the student is watching us as to how we are doing it. And they learn a lot of it by sitting next to you or you, Dr. Gupta, or to us, as to how you behave, they start behaving with their patients. And that's where probably communication,
Exactly.
although it can be taught, like I examined for MRCS, communication bay is a very important bay. Most
Yes.
students, most Asians have a trouble there because they are not used to it. So they cram it up and they crack it. It is getting better, but we need to work at the communication of faculty also. The way you communicate to
Yes.
the patient is what they would do. So overall, I agree with you. The idea is that we can put it in the curriculum, but end of the day, it has to be practically seen happening.
Yes.
So that becomes a day-to-day working. So at least they should be polite enough to talk to a patient. Doesn't matter how big is the struggle of number of cases. When breaking a news about death or cancer, or talking to the patient can
Yes.
be an issue, attendant especially. And importantly, as you very rightly said, it's the reaction.
Yes.
Even if it has happened, don't react in a manner
Yes.
that will invite an assault. I'm not trying to at all accept that society can do it, but if society is doing it, we just can't be reacting and making
I
it
want
all
to
a
share.
hash of it.
I want to share one.
So we quickly move.
Sorry,
Yes, quickly
yeah.
one. Yeah.
I mean, it happened during the 92 bomb blast, serial bomb blast in Bombay, and I had several patients which I was operating practically from Friday night onward till about Tuesday morning. And incidentally, it was out of my practice or out of my this thing. Every time I finished surgery, I would call the patient relation and introduce the surgical team. So this is the
It's a
doctor
brilliant
who has-
idea. So
who has
now what has
helped in
happened is Dr.
anesthesia.
Gupta's resident has
Yes.
already been trained into a communication skill,
Absolutely.
which can be in any language, but they can learn to be polite. That's the least you can do. It's the right thing to do.
And it happened that after some time, it happened that one of the anesthetists got met with accident somewhere, and there was nobody to help. Incidentally, one of the patient relation recognized this was a doctor who gave anesthesia to my
There you are.
person. And that helped. So sometimes these communication with the society on a positive side also helps building of faith in the society.